later with other interested people. Good evening, everyone. My name is Jorik from Panterij Opleidingen. Together with Laurie Colford and René Zweedijk, we are the organization of the Paediatric program in Norway that starts in March 2026. My job in this part is the practical part. So all questions about administration things, the website, things like that, you can ask me. And for all other questions, Laurie will help you around, and she will also start the presentation in a couple of minutes. For the presentations, it's always nice to have everyone with the cameras on. So if you are able to put your cameras on, it would be very nice for Laurie to see you when she presents everything about the program. So enjoy the webinar, and Laurie, it's up to you.
Welcome everyone. Good evening. Happy you're here, and I'm happy to tell you something about the pediatric program we're going to run in Norway, as we had done a couple of years before. That was in Jessheim, and now it will be in Drammen, and we're really very pleased to do that again. I will tell you well, what we're going to do, and I would like to do that today I will start with a short presentation of a case, a baby with the plagiocephaly. After that, there will be time for questions, but feel free to ask questions anytime you want, so you don't have to wait till the end. When the case is done, I will go with you through the structure of the course. Every weekend, I will explain what you're going to learn, what we're going to do. And after that, another short example of a case from concerning a child, 7, 8 years old. So that's what we're going to do. Let's say, in your practice, there will be a question from parents with their first child. A baby comes in, the baby is 2 months old, and the pregnancy was well, actually, no problems at all. During the course, there will be a full weekend of 2 days of pregnancy. You will learn everything about pregnancy, all the terms, all the things that can happen, what should be good, what is not so good, and what can we do with it. So there is a teacher specialized in that. Well, she gives this course for many, many years. She's well known and very experienced. So all your questions about pregnancy will be answered by Sabine. And well, in this case, the baby, the delivery was a very prolonged delivery. It took a lot of time, and eventually the delivery was helped by vacuum extraction. So that will do something for a baby. During the course, we will talk about it, what kind of deliveries there are, what kind of problems there might appear during delivery, and what that means for a child. Because that is something, if you are born without any trouble or with a vacuum on your head, I think you can imagine that will do something for you. So how can you see it? How can you feel it? How does it feel? How does a cranium feel after a delivery with a vacuum extraction? These are all things you're going to learn. Then this baby had a good first breath. We will talk about first breath several times. Also with first breath, you can imagine if you are born and you are able to breathe freely, you take your first breath in a new kind of world, from the inner world in utero to the outer world with gravitation, with it's cold, it's loud, there are a lot of lights shining on your face. That's all new. And if you can take your first breath fully, your diaphragm will open up. It will help your fluids reorganize. That's a whole different case than just a minimum inhalation. So you will learn how to feel that, and you will learn the consequences for a child. So in this case, first breath was great, APGAR score was great, but the baby presents itself with a dominancy of the rotation of the head to the right. And the parents haven't noticed it. At least, well, they have noticed it, of course, but they didn't notice it on time that this has consequences for the skull. And then you, of course, you get a plagiocephaly. So the baby also, we're going to talk about plagiocephaly, but we're going to talk about plagiocephaly right now. And during the course, there will be explained all the reasons and all the kind of treatments you can do. This baby is also crying a lot. Mom is breastfeeding. Sleep is not going smoothly. And tummy time is a no-go. Tummy time means crying, which you often see with a dominancy of rotation of the head. What are you going to do? Well, first of all, we always start with observation. That's what you're used to, even if you do not treat children yet. But it's not only observation. What we're going to do during the first weekend is also asking you the question, what is a child? And Renee might talk about that later as well. Because a child is not a miniature of an adult. A child is special. A child is whole. And there might be something with a child, but the child is so pure and so whole that it will change something in you. At least it should. The approach of a child, and especially a baby, is different than you can approach an adult. So before observation, we're going to talk through with you, and we're going to practice it, how you approach a baby, how you approach a child. And during that, you use your skills of observation. So in this case, it's a healthy baby. He has good eye contact. He smiles. But what you can see is the whole banana shape. So there is a side bending to the left and a rotation of the head to the right. And then you get the whole banana shape of the baby. And you can see even from in the face, you can see a slight asymmetry. So that's those things you will learn to observe and know in a minute. When you look closer, you will learn all about reflexes. When you look closer, you can see an ATNR dominancy on the right side. ATNE is an asymmetric tonic neck reflex, which presents itself when you turn your head to the right. Your right arm is straight, your left arm is bended, and so are the legs. If you see that, then you know there is a brainstem activity, hyperactivity. We will also tell you about general movements. General movements are those adorable dancing movements. They are so important. That general movements will tell you something for your diagnosis. So there is a lot just you can learn from observation and approach in a baby. And yeah, we're going to explore that all together. And in this baby, I also saw that the baby was hyperextending during the side bending and the rotation. So it was not just a flat side bending, but also hyperextension. That means something that the whole nervous system is very, very agitated. An example how you are going to examine the baby. A baby is very sensitive on the head. So you will learn that it's not a brilliant idea to start at the head. You will lose contact with the baby. There's a big chance the baby is going to cry. So the best thing is to start down with the feet, or if the feet are fine, you start with the hips or sacrum and the pelvic area. From there, I like to go to the diaphragm and then go back to the belly, but that's just my preference. So that's not a rule. It depends on the baby, it depends on the situation. You will examine the subdiaphragmatic organs and the intestines, the kidneys, everything. You will learn how to feel a difference between a dysbiosis or congestion of the belly. These are all things we're going to talk about several times from several point of views. Each weekend, there will be another teacher, perhaps two, and they will all talk from their point of view and their experience. So that makes this course so complete. You will hear it from so many angles, and we will give you the chance to find your way and yeah, what is close to you. So from there, you go from the diaphragm, you go all the way up to the lungs, to the clavicle bones, to the cervical spine. And of course, with plagiocephaly, the OAA, the occiput C1, C2 area is very important. The cranium in detail. Is there something wrong in the cranium itself? And there will be a weekend all about baby reflexes, how to test them, how to observe them, what does it mean? Does the reflex has to be there or it shouldn't be there? So it's very broad, actually, the examination of the baby. Are there questions so far? No? Okay, the osteopathic approach. Before you're going to treat, in this course, we want to be sure that you are able to work safe, that you know your differential diagnosis, and you know your safety test. We will guarantee you, if you finish this course, you are able to work in a safe way and in a confident way. Actually, that is the most important thing of the whole course, that you are safe and that a child is safe because you know how to work safely, actually. So differential diagnosis, I will give you one. You have to think, is it a craniosynostosis? Is that a right pronunciation? I'm not so sure. Anyway, you know what I mean. Or is it a functional plagiocephaly? What would you think of other differential diagnosis? Where do you think of with a baby plagiocephaly, the baby I just described? Just shoot. There's no wrong answer. You can open your mic, you can say it, you can type it, I think. Then Yorick has to step in. Who dares? Shall I give you another one? Torticollis. A torticollis, we will offer the subject in a broad way. There are different types of torticollis. There are different causes of the torticollis. You have to know to treat them. You have to know what you do. So you have to know what it looks like and what's behind it. Fused vertebrae. The baby should be, or it is possible the baby is not able to turn the neck. I must say, in 21 years, I have never seen it in my practice, but you have to be aware of it. A clavicle fracture could be the reason. That could be just more an osteopathic differential diagnosis, like a problem at C1 in rotation. There also could be hip dysplasia. Hip dysplasia has, as a consequence, often, if it's not bilateral, side bending of the trunk, and with the side bending comes the rotation the other way. So the hip you should always examine. For safety, we have to look at the fontanelle. Is it, oh, my English right away. Is it down or not? Is there a fluid feeling? Is it filled up or not? And so there are many things you have to look for safety. How is the child breathing? Is it normal breathing? Is it not normal breathing? That is a real safety thing. You have to send the baby in if the breathing is not right. Vitality, how does the baby look? Is it vital or not? Is it sick? Does the baby drink enough? Are the diapers enough? And there is another one. You know that? Where do you look for in a baby? Does it gain weight? That is not so important in case of plagiocephaly, but in general, we have to take a look. Is it safe to treat this baby? So, and then what can you do with it? Of course, that's a main part of the whole course. You will learn all kinds of treatments so that you can choose and you can feel what is right for this child. So you have to get familiar with all the kind of treatment, and then you can choose what belongs to this child. And we will all find the way according to the Educational Council on Osteopathy, the model of 5. So biomechanical, neurological, respiratory, circulatory, metabolic, and psychosocial. In this case, anyone who dares now? Not yet. Well, biomechanical is clear, right? It could be muscular, it could be osseous, it could be, well, any of those things on any level, like the hips, like the neck, like the clavicle bone, in the cranium. Is there a problem of the occiput? You don't know, but it could be biomechanical, could be neurological as well. Could be neurological in the way of a dysfunction at brainstem level with all its consequences. Renee will talk about that shortly. And on reflex level as well as neurological. Respiratory, it could be a lung problem. It could have started with a lung problem. When, for example, if the baby doesn't move well in utero, can't move the arms, there will be less development of the lung. If that's unilateral, there could be a problem of the rotation when the baby is born. It's not that it happens very often, but it could be. Metabolic as well. If there is acid reflux, the baby might have a tendency to side bend to the right, hyperextension to give air to the stomach area. There could be a dominancy, rotation to the left, for example. Psychosocial in this case is not very likely. Are there any questions so far? This is a short but quick sharing of how we look at the observation, the approach, the examination, and the treatment of baby. That's in a short vision how we're going to work. I can't see you all actually in my screen, but if there's any question, please ask. Feel free to ask. If not, I will continue. So the program content, I guess you have all had an email with the content, so that might be clear. If not, I will go through it. The first module will be given by Renee. Renee, would you like to tell us something about it?
Well, I'm sorry for my camera. My camera is not working well, but I hope you hear my voice. So I'm very happy to take part in the program. You will see me twice or 3 times in the complete program. I will open and I will do the introduction, and of course we talk about what is the difference in treating a child compared in treating an adult. And so what we know in most countries in Europe and also outside Europe, in the basic osteopathic training, the treatment of children is mentioned, but is not so trained. And what we want to do is we want to really train the people in treating children. And that's why the first weekend is important, because we look as a child as a developing system. And a child is a developing system means that during the development, dysfunctions in any kind, you saw the 5 models, will influence the end result. So when there is a mechanical or neurological or metabolic dysfunction and the child is developing, is growing, that it will strongly influence the result and influence the functioning of the child, but also will have consequences for later life. So, and we will go over all the different systems, see how the different systems develop. We look at the cranium, we look at the skeleton, of course, we look at the organs, we look at the immune system, we look at the autonomic nervous system, we look at the endocrine system and all the systems, and also the biosocial system, which is strongly connected to structure. We will go dive into. That's the first day. And then the second day, one of the things that is a little bit my part of my complete life in osteopathy is the neurophysiological explanation of what are we doing when we are treating children. And one of the things that I saw in the all the time that I'm lecturing all over Europe and outside Europe is that people often mention the role of the vagus nerve, which also is important, but I think there are other possibilities and better explanations of what we actually are doing. So we dive into the rhombomere, which is a segment in the brainstem. I will tell you about facilitation and what this means for the behavior and the dysfunctions in children. And then I will go into the spinal treatment, and I will show you how gently you can correct an upper cervical spine with not using manipulation, but with soft techniques, which are very, very effective. So that's what I'm doing. And the second 2 days of the first module, you will get a model of how to generally approach children, how to examine them, and how to treat them. And so 2 days we will go into that. And that's another colleague of mine who is doing that. So that's the first module. Thank you, Laurie.
Thank you, Renee. And then module 2 will be all about the pregnant women, because we do think that's where life starts. So we can do a lot for pregnant women. We can help them with all kinds of problems like a pelvic pain, diaphragm pain, with I don't know how to pronounce it in English, I'm sorry, but it is hyperemesis gravidaris. I think you will recognize it. Have you translated a little bit with another accent?
Extreme nausea. Yeah.
Oh yeah, I could have said that too.
Extreme nausea. Yeah, you can say that.
Yeah, thanks. And it's important for us to know the theory about it, or about the different stages in pregnancy. So that's it. And then in the same weekend, the other 2 days, I will be there with my colleague Cindy, and Cindy will tell you all about birth. She will do that during a webinar, but also a short bit of practice. And I will give you balanced ligament extension that is a very nice way to treat a baby. It's nice for adults too, but especially in babies. It's a very good way to treat a baby. So that's another approach of how to treat a newborn. So after these 2 modules, you are able to treat a baby and a pregnant woman already. And that's why we have chosen to do this in the first 2 weekends, so you can start working immediately, actually. Module 3 is all about the newborn cranium, all the ins and outs of all the bones, the cranial base, how is the occiput built up, when does it ossify, what does it mean for your treatment. During all the modules, we will help you with your way of treating. How soft are your hands? That's what you can read. But that also means that you learn the difference between palpation and sensing. Sensing is a way, an afferent way, where you receive information and your hands will be very, very soft. The other 2 days will be about the morphodynamics based on the work of Blechsmith, but in practice. So you will learn how to feel and how to treat from an embryologic point of view, and that makes sense. It will be so much more logic to you, how the intestines move, how all the relations of everything in the body is related to each other, and why. And then after that, the last day, that is what I love most. That will be the first clinic day. And please have no fear about that, because it's not about judgment. It's not about, oh, I have to do it right. I have to show them what I can. No, not at all. It's a very friendly way of working together. We will invite the former students who've done the first course, a few of them, we will invite them to be a tutor. So you have a tutor at your table. We will work in probably with 4 or 5 colleagues, and you will change roles in that. And yeah, well, that's what I like most the last few years in this course, because it's so much fun. You learn from each other, you trust each other, you get to know your colleagues better. And yeah, it's really working together. So after that, and you learn so much from it, really. You can ask for help. Can you let me feel how you do this? Or can you do it with me together? That's really amazing. Module 4 is all about the visceral treatment of the newborn. So all about reflux, colics, everything that has to do with the visceral system. And the second 2 days are about feeding problems, tongue tie, all the red flags, and the normal and abnormal motor development. So in the development of the child, you have to know milestones. And that doesn't mean that a child has to be able to do it exactly on time, to progress exactly on time. No, not at all. A child develops in its own way, but you have to know, okay, this is okay, or this is not okay. Followed by the second clinic day. And you will see that you are going to grow every clinic day. Module 5 is all about the visceral cranium. So that includes everything about the development of the face, the middle face, the whole face, all problems with otitis, with tear duct, blocked tear ducts, everything about the senses, actually. And I'll be back for the next 2 days, all about primitive reflexes in newborns. That is my thing. Yeah, I can talk hours about that. Won't do that now, won't spoil it, but I will show you all the reflexes a young baby has and needs, and when the reflexes should be gone, and so on. And well, it's not the last, but it's the last one before your practical exam, is Renee will be back. I think Renee, yeah, I think so, about the neuroendocrine immune system and the problems in children. He will tell you all about that. And someone will come in to teach you the first aid in children, also necessary. And then you're ready to do a practical exam. Before you can do it, we do it online, so very easy to schedule. You have to write a case about it. You have to search for theory around it. So you're really good into the subject you chose. It's all about a child under 2 years old. And after that, you will present it online, and we will look for not exactly what you're doing, because we have seen that during the lessons and during the clinics, but we want to know how you think, what is your opinion, why you do what you do, so you're really confident that you know what you're doing. Then there are another 3 or 4 modules. And those modules are about the child from 2 years and older, all the way up to the adults. So the first one is about orthodontics. Orthodontics, I don't know in Norway, but in Holland, every child gets braces. But that's something for your whole statue, for your whole central tendon. So we can help them with that. Followed by visceral case studies, or case studies in general, everything you want to know, but case study related. Module 8, central nervous system, and Renee, yeah, I think you're going to you will go there 3 times, Renee. The child with the developmental disabilities. Not all of you will see them in your practice, but some will. And actually, I hope a lot of you will, because we can do so much for those children as well. Followed by me again, and there I will talk about primitive reflexes about 5 years and older. And the next case will be about that, so I'll talk about that. But there are many problems related to reflexes, like bedwetting, writing problems, reading problems, behavioral problems. You can do a lot with reflexes integration. Another clinic day in which we will see children with these problems. The last one, orthopedic problems in children, from toddler to teenager. Everything, morbus saver, yeah, anything you think about you will see there. And a special day about ear, nose, throat, and ophthalmology. Ooh, tongue breaker in English. Then during the whole program, there will be e-learnings, like I said, that Cindy's going to do about the birth. Everything that has much theory will be done by e-learning, so we can use the weekends for practice. I think you learn the most by that. And then it's up to you, but to end your study, you have to write 2 case studies, but we will talk about that a lot. Like, yeah, we will instruct you how to do that. So
Laurie,
that's all.
there is a question. There is a question over the chat. It's from Kaya, and she's very excited, and she has one question. Wouldn't it be good to have more information about primitive reflexes in the start of the course, making us secure from the start?
Well, you will get it in the second module, actually. Is that your question? But Or do you want to know if you have to do some pre-work before it? Then the answer is no. I will tell you all about it.
So Kaya, it is in the second module already, so it's in the beginning of the course.
Yeah. Is it? No, it isn't.
Okay,
No.
thank you, she says. Okay.
Okay, good. Okay. I will talk about reflex a little bit, okay? Example of the case. It's out of my practice, actually. In 2018, I started with studying reflexes. Before that, I had no idea. So what I saw was when I had seen a baby in 2014 or something, and I was pretty sure there was no dominancy in rotation and side bending anymore. It was totally free. And still, when they were 6 years old, 7 years old, they came back with reading problems, behavioral problems, writing problems. And when I tested them, there still was rotation to one side. And I thought, how? Was pretty sure I freed it up. And I did, on an osseous level, on a muscular level, but not neurological. Because I had no idea what an ATNR, a restrained ATNR, meant for the development of a child. So that's why we do want to offer you this opportunity to learn about reflexes in baby time, what we can do and have to do with the babies. Now I don't see them back anymore at 6 or 7 years old. Absolutely not. Because now I know what to do, what we missed. But all the knowledge about reflexes is not in medical school, was not in my physical therapy time, was not in my basic osteopathy study. So, but it will be now, not in a basic one, but in a pediatric course it is. So, yeah. Because let's say I have not treated him, then there is a chance the baby comes back, or the child comes back at 6 years old with still an ATNR on the right side, still a motor reflex. I told you about the hyperextension. And as a result of those reflexes, the child is suffering from eye tracking problems and saccade problems, probably you say it. That means that the development of the binocular vision didn't go right. If your world exists only on the right side, your eyes will develop differently than having straight vision or left and right vision. Logical, isn't it? So that's what you see a lot. And those kids suffer from reading problems, writing problems, concentration problems. And if you can't read well, if your eyes are all over the place, you lose track on where you are with reading. What are you going to do? You're going to look up and you're going to wander around in classrooms. So the teacher will say, hey there, come on, focus. And we'll tell the parents, no, your child has a concentration problem. It hasn't. It's an eye problem. And it's not an eye problem in the sense of vision. It's a perceptual problem. So, yeah, we're going to talk about that. The motor reflex, the one you see in babies with the hyperextension, might be a combination of TLR, tonic labyrinth reflex, and the motor reflex. But if the motor reflex doesn't integrate, it will keep you in a fight-flight system. So it will keep you in a sympathetic state. And in turn, it will cause midline problems as anxiety or timidity or hypervigilant. But you can't stay that way. If you stay that way, your neuroendocrine system will go down. You will suffer adrenal insufficiency, tongue breaker, immune system problems, or vestibular problems. They get car sick, motion sickness. and or behavioral issues because you don't know how to behave. You are struggling, you are in survival mode to follow the lessons at school. And that's what we see a lot today, nowadays, actually, in school, in that age, and older as well, teenagers as well. And I'm pretty sure you will see the same in Norway. Although you enjoy nature more, you have much more nature in Norway than we have, because here it's all built up, and so there might be a chance it's better in your place, actually. That was my talk. Do you have any more questions? Because I can't see the chat, actually. So if there are questions, please tell me.
There are no questions in the chat, so.
Okay, if you come up with questions later, you can send an email to Yorick, and it will be answered as soon as possible.
Sorry, I've got a question.
Please.
So I'm German speaking, and a lot of the medical terms or words I'm not so used to. So I wonder how I'm gonna get through it, and catching up the speed of teaching with getting used to these new terms and words. What is your experience with this?
The last course we had someone from Finland and England as well. That was no problem at all. German looks a lot like Dutch, isn't it?
Mm.
Maybe you do understand the Dutch terms, so that is no problem for the teachers to share with you.
Yeah, the teachers teach in Dutch and it's translated in English, or how
No,
does
English.
they
They'll
teach in
teach in
English.
English.
Okay.
But most of them also talk German. So für uns ist es absolut kein Problem, ein Teil mal in Deutsch zu unterrichten und das andere Teil machen wir in Englisch.
Okay. And the other question is about is it possible to take video recordings? What are your rules in your school with this?
I want to respond. What we don't like is that when we are showing a technique that we look at 20, 25 people all standing with their cell phone in front of us. So what most of the time, what we do in our organization is that we, at the first day, we ask, okay, who wants to make the videos? And most of the time there is a volunteer that makes the videos, and then we make a groups app in WhatsApp or in other there are many possibilities, and then we share all the recordings. So one person is recording, and then we share it with everybody, and it works well.
Perfect. Yeah, great. And the last question, if it's not possible to take part of a course because I get ill or any other reason, is there? It doesn't sound as if the course will be repeated within the next year, so maybe some years later. But is it possible in any way to
Yeah. First of all, we when you are sick and we know it in advance, we can make recordings, and
Okay.
we can share the recordings with you. And we can't be sure that we will do a second one. We have to be honest. We don't know. We don't know. What we do know is that you can come to us in the Netherlands, but then of course the lecturer are in Dutch, but you will see the techniques and they will help you. That's another
Yeah.
possibility. Yeah. Yeah.
Okay.
So, but
Yeah.
there will be recordings. Yeah. Yeah.
Mhm. Okay. Yeah, perfect. Thanks.
Any other questions?
The only thing that I want to add, Laurie, thank you for your excellent talk, is that the program that we have is already running now for 25 years in the Netherlands. And we also did it 2 times in Norway. But there were some problems with the location with Jessheim, and so we did not want to continue there. We did it once once or twice in Copenhagen, several times in Poland. We did it in Germany, and so we have very experienced teachers that and. One of the things that's my function is that I'm in contact with other schools in Europe on a postgraduate level, and that we are now working on a network of pediatric programs, and that we share the content of our courses, and so that we know that we are a little bit teaching the same things in all the countries. So the program is not, formed with a good glass of wine in front of a friendly fire, but no, it's really developed in the communication with other countries and over many years. So that's what I want to add.
That's true.
Payment questions are for Jorik. He's our financial man.
Yes, for the practical information, I will keep it short because if ever you have any questions or want to know more, you can always send us an email, call, or watch our website. We have a wonderful location in the center of Drammen, thanks to colleagues from Drammen, Ingvild and Ingun. They are both here too. I already visited them and they showed me around Drammen. They showed me how to travel, the location, and it's really very nice, and it's very good to travel there. And also in the evening, you can have some time off in the center with some nice restaurants and bars for the ones who want to go there, or shopping for the ones who want to do some shopping. So that's all fine. So registration, if you want to register for the course, you can go to our website, and there you can do the registration. If ever you have any problems, please send me an email and I will help you with that. We need a minimum of 24 participants to start the course. At the moment we have 4, so we still need some more. So if ever you are interested, please sign up and maybe share the word, and so we have more colleagues, so we can start this March with the course. For the ones who want to pay in terms, that's possible without extra cost, because it's an investment for you all. So it's no problem to pay in terms. The exact terms are on the website. I think the maximum of terms is 8. If there's problem with that, please let us know and we can try to figure out something. We always try to be flexible in that. And for the last thing, the timetable of the weekends, we always start the first day of the course at 10 o'clock. This is because some of the colleagues have to travel, so they need some more time. And we end the first day at 6. And as you can see, the second and third day will start at 9 till 5. And the last day we start at 9, but we end a little early so people can travel home or have some time off for themselves. So that's it about the practical questions. We keep on promoting the course. We also had some information shared with Thomas Collin from the Federation, and he shared it for us through a newsletter and in the magazine that's coming out. So we are hoping that we have enough participants, and we keep on promoting the coming weeks and months. So please help us to share the word and spread the word. I think thank you for your attention. Laurie, I don't know if you want to finish it because you were the main speaker this evening, or...
No, I think I said it all.
Okay. So in the last dia, Laurie, if you can put it on. If you have any practical questions, you can send me an email, info@proosteo.com or jorik@proosteo.com. If you have any questions about the content of the course, please send it to Laurie. I will share this handout and the recordings with you. So if you want to look back at something from the handout, feel free. So if you have any questions for now, I will keep my camera on. Otherwise...
Angelica has a question that I want to answer. She asks, will it be some kind of master? Because we are not a university, we can't give a degree. But what we do is we look at the way that the information is spread at the master level, and we do it in the same way. So we can't give you a master degree, of course, but the kind of education can be compared with a master degree. So that's what I can add. Yeah.
So are there any other questions about the content or practical questions? Just check the chat.
Yeah, so do I.
No questions for now.
No, there are no questions, so I think we can stop. Yeah.
Yes. Thank you very much. Have a nice evening, and we hope to see you all later. And yeah, have a great evening. Bye-bye.
Bye-bye.